Small incision cataract surgery is now practiced in both developed and developing countries. It involves the extraction of a nucleus from the capsular bag and then through the sclerocorneal tunnel. A number of techniques of nuclear delivery have evolved over the time. These techniques have their own merits and demerits. However, they give similar results in the hands of experienced surgeons. In this video, we will discuss nucleus removal by irrigating wire vectis in small incision cataract surgery. We will also discuss some of the ways to prevent complications with this technique. But first, we would like you to subscribe to this channel so that you may not miss our new videos. You may also share the video with those who may like this topic. Check the description for similar videos and product links. Nucleus removal by irrigating wire vectis. You can use Mcintyre irrigating wire vectis to deliver the nucleus either by hydroexpression or by viscoexpression. But first, what is an irrigating wire vectis? Mcintyre irrigating wire vectis is a modified wire vectis with a thick loop made of hollow wire. It has an anterior concave surface with 3 small openings. Posterior end of the loop is continuous with a hollow handle which is attached to the syringe or infusion set. It separates nucleus from capsule and facilitates easy nucleus delivery by providing additional pressure. It maintains the anterior chamber after delivery of the nucleus, which minimizes the damage to the corneal endothelium. It is used for either hydroexpression or viscoexpression of the nucleus in small incision cataract surgery. The irrigating wire vectis is introduced from the tunnel and simultaneous counter pressure is applied at the 6 o'clock position using lens hook. Deliver the nucleus by hydroexpression. It basically means removal of nucleus out of scleral tunnel using fluid. In this method, you attach Mcintyre irrigating wire vectis to the infusion set. The nucleus is prolapsed into the anterior chamber. Viscoelastic is injected both above and below the nucleus. Mcintyre irrigating wire vectis is insinuated below the nucleus and the infusion starts to generate a pressure in the anterior chamber. You gradually withdraw the vectis along with the nucleus out of the tunnel, while the globe is stabilized by holding with the forceps at 6 o'clock position. Pressure on the posterior lip of the tunnel guides the nucleus out. Alternatively, you can attach the vectis to a 5 ml syringe containing VSS. After immersing the nucleus in viscoelastics, hold the superior rectus suture loosely in your left hand. The vectis is positioned as earlier. The superior rectus is pulled tight and the globe thus fixed. The irrigating vectis is withdrawn slowly without irrigating till the superior pole of the nucleus is engaged in the tunnel. The irrigation is then started and the vectis slowly withdrawn while pressing down on the scleral lip. The force of irrigation has to be reduced when the maximum diameter of the nucleus just clears the tunnel. This step prevents the nucleus from being thrown out forcefully with sudden decompression and shallowing. Delivery by viscoexpression. Here the vectis is attached to a syringe carrying low molecular weight viscoelastics. Nuclear delivery is accomplished as before except that viscoelastics are used instead of VSS. There are many advantages of wire vectis technique. In this technique, only one single instrument is used inside the anterior chamber. Easy and faster delivery of nucleus. It is especially useful in case of premature entry in the tunnel and superior zonular dehiscence. But it has certain disadvantages as well. It may cause crushing of the inferior iris between the vectis and the nucleus. If the vectis is not positioned properly. It happens if you're not well trained in the technique. It may cause endothelial damage if the chamber is not kept sufficiently deep during nuclear delivery. You should keep in mind that the insertion of vectis itself leads to some amount of shallowness of AC. Finally, irrigating wire vectis is difficult to maintain. The pores on vectis have a tendency to get blocked very fast. It is advisable that you should check the patency before you use in the patient. Hope you liked the video. Feel free to share your views on this issue in the comment section. Check the description for similar videos and product links.